Hey everyone, welcome back to all my listeners. This is episode 10 in season 14. Today is Wednesday, March 5th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, can you believe it is already the month of March? I know that it's starting to stay lighter out here in the Midwest till almost 6 o'clock. So it makes me really, really happy. I know we're having a time change next week, so I'm looking forward to it. I think it's next weekend, or is it this weekend? I don't remember. I'll have to look at my calendar. All I do know is I'm excited that the weather should be turning a bit warmer here, hopefully in the Midwest. Some rain showers rather than snow showers, hopefully, are going to start to bring those spring blooms, those trees, those tulips, those hyacinths, all of that great stuff that makes me really happy. So I'm looking forward to it. All right, you guys. Now, today's Newsworthy is going to be featuring the latest on the hospital price transparency rule. And there's been an update for 2025. Now, in my trusty tip, I wanted to spotlight yet another code change for 2025. And that's going to feature the HCPCS code G2076. And if I'm feeling nice as I'm recording this, I might throw in another coordinating G code. And of course, I'm going to close out and round out today's episode with a remarkable quote on change by John F. Kennedy. Today's episode is sponsored by HCPro. Are you new to coding or looking to sharpen those coding skills? Look no further than HCPro's Certified Coder Bootcamp Original. It is the ultimate training program for mastering ICD-10-CM, CPT, and HCPCS Level 2 coding. This intensive course is designed to help healthcare professionals like you to develop a strong foundation in coding principles and guidelines, whether you're coding for professional services or hospital outpatient settings. This bootcamp has you covered. Now, you're going to gain comprehensive understanding of ICD-10-CM, CPT, and HCPCS Level 2 manuals. You'll also have hands-on practice with over 500 coding exercises, real-world application at its finest. And of course, you'll have personalized instruction in small class sizes, ensuring that you'll get the attention you need to succeed. Now, HCPro's next live in-person Certified Coder Bootcamp Original is being held in Charlotte, North Carolina, and it starts in just a few weeks, Monday, March 17th, and runs through Friday, March 21st. Now, as a special thank you, they will still be honoring HCPro's special promo code that they created just for me, Sonal15, at checkout on hcmarketplace.com. So make sure you quickly log in to hcmarketplace.com and use that promo code Sonal15 at checkout because it will save you 15% on your registration. So let's get into Newsworthy. Now, an executive order was issued last week, which indicates the Departments of the Treasury, Labor, and Health and Human Services, that's our HHS, they will take the following actions regarding the hospital price transparency rules. Now, number one, they will ensure that hospitals and insurers disclose actual prices, not estimates, and take action to make prices comparable across hospitals and insurers, including prescription drug prices. And number two, the Departments of the Treasury, Labor, and HHS will update their enforcement policies to ensure that hospitals and insurers are in compliance with requirements to make prices transparent. Now, existing CMS regulations require that each hospital operating in the United States are to provide, number one, a comprehensive machine-readable file with the standard charges for all items and services the hospital provides. And number two, they will display a shoppable service list in a consumer-friendly format. Now, CMS is planning a more systematic monitoring and enforcement approach per the executive order. Now, consistent with standing CMS policies, non-compliance will be addressed with swift enforcement. Now, just some fun facts here. For 2025, as of January 16th, 2025 specifically, There is one surgical hospital in the state of Texas that is under review. Now, findings include 2 violations. Violations, requirements for hospital standard charges. 1, failure to make public a machine-readable file containing a list of all standard charges for all items and services online as required at 45 CFR Section 180.40A and 45 CFR Section 180.50A. Specifically, no online machine-readable file was found. And then another violation for displaying shoppable services in a consumer-friendly manner. 1, failure to make available a consumer-friendly list of standard charges for a limited set of shoppable services as provided in 45 CFR Section 180.60, as required at 45 CFR Section 180.40B. Specifically, no consumer-friendly list of standard charges was found. Now, the civil monetary penalty, or CMP, is based on the findings of noncompliance with requirements for standard hospital charges and displaying shoppable services in a consumer-friendly manner. CMS is imposing a total CMP of $62,016 pursuant to 45 CFR Section 180.90. And now it's time for my best practice tips in Trusty Tip. So let's focus on another code that has been changed for 2025. Now, this code has been around since 2020, but there have been changes that were made to the definition. Now, some of these changes I'm going to try and stress as I'm reading this new definition. And of course, this correlates really nicely to the work I do every day as I'm auditing various specialty providers, specifically in the behavioral health space. Now, this HCPCS code is G2076. Now, by definition, it is intake activities including initial medical examination that is, and here comes the brand new change, that is conducted by an appropriately licensed practitioner and preparation of a care plan, which may be informed by administration of a standardized, evidence-based social determinants of health risk assessment to identify unmet health-related social needs, and that includes the patient's goals and mutually agreed upon actions for the patient to meet those goals, including harm reduction interventions. And this is also new, the patient's needs and goals, and this is all the same from 2020. In the areas of education, vocational training, and employment, and the medical and psychiatric, psychosocial, economic, legal, housing, and other recovery support services that a patient needs and wishes to pursue, conducted by an appropriately licensed, credentialed personnel. In parentheses, it says provision of the services by a Medicare-enrolled opioid treatment program, list separately in addition to each primary code. So I thought that was really, really informative and useful new changes that CMS included in this HCPCS code, G2076, because a lot of that language, a lot of those things are requirements when you are billing for a Medicare and even a Medicaid type of a product for these types of opioid treatment programs. It's a must that there are plans of care that are involved as you look through the various state plans, through the various requirements from these two particular payers in general. Now, I said I was going to be nice in the beginning, and I'm definitely going to include a bonus. So, because the two codes go together, so it makes sense that I include G2077. Now, it also had some important changes made to the definition. And again, it's been around the block. It has existed since January 1st of 2020. But again, these changes were made in the definition. Now, it is for periodic assessment, assessing periodically by an OTP, that's your opioid treatment program practitioner, and includes a review of the MOUD. The MOUD is the medications for opioid use disorder dosing. Now, this is what is new. So, review of the MOUD, those are those meds for opioid use disorder dosing. And then all of this that I'm going to read for a bit is brand new. It's a brand new change. So, dosing, treatment response, other substance use disorder treatment needs, responses, and patient-identified goals, and other relevant physical and psychiatric treatment needs and goals. Assessment may be informed by administration of a standardized evidence-based social determinants of health risk assessment to identify unmet health-related social needs or the need and interest for harm reduction interventions and recovery support services. Now, parentheses, this is what was included since 2020. Parentheses, provision of the services by a Medicare-enrolled opioid treatment program, list separately in addition to each primary code. Again, I think both of those code changes are relevant and necessary. It just matches in terms of the definitions and requirements for compliance in terms of documentation standards that are required when folks like myself in compliance in the world of auditing, when we are requesting documentation, we request those types of things in terms of plans of care, treatment plans. There has to be evidence of, goals that are being set, that are measurable, that are agreed upon. There are so much criteria that are involved when you are in the space of behavioral health, in particular for these types of substance abuse programs and facilities, etc. So I wanted to put that spotlight on today's episode. So I hope my audience gets some really great trusty tips, some nuggets on what those new changes are that I tried to stress. So it's not a brand new code. They've both been around since 2020, but with these additional changes, I think it's going to go a very long way in terms of practicability and considered usage on appending these types of codes when you are sending claims out the door. It just makes a lot more sense. So I love it. All right. And finally, I focus season 14's Spark on change. I want this 14th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their insights and their wisdom on change. So in this week's inspiring quote in Spark is from John F. Kennedy. Change is the law of life, and those who look only to the past or present are certain to miss the future. So very true, right? This quote reminds us that change is everywhere. Change happened in the past. It most certainly happens today. All of that change is meant for the better, for the hope that change is the best for our future. I'm happy JFK's spark still burns brightly and still inspires so very many. All right, you guys, that wraps up today's short and sweet episode. I'm hoping that all of you guys are going to take the time to move those clocks forward. I believe it's this weekend or next weekend. Make sure you check, but look outside because it will be lighter until later. And I'm so excited. Let me know if you guys are starting to see any flowers in bloom. I know I have tons of friends and colleagues out on the West Coast. Of course, they're seeing amazing things. So I can't wait till they share some photo ops with me. I've got people going out to wine country in California. I wish I could go with them and join them, but I'm very busy here doing speaking engagements and things like that. So hopefully one of these years I can head over to California and do some Napa touring myself. But I did have a really nice wine tasting that I talked about couple episodes ago, was an amazing sommelier that came out and taught us so much about the different types of wines, so many varietals that I'd never even tried before because they were literally straight from France. I was just tickled pink. So anyways, you guys, let me know what's going on for the month of March. Hopefully, you guys will tune in to March Madness basketball like I do when that starts up here in a few weeks. But anyways, I'm looking forward to a better season. Bye-bye winter and hello spring. All right, you guys, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.